Hi, I'm Will, and I'm 63 years old. I'm from the local area, Melbourne, Seminole County. I'm recently married. A little bit about myself. Uh, I'm a military retiree. I came from the submarine force, and that's probably one of the reasons why I came to see Dr. Dominguez. Submarines are not, you're out to sea for quite a while, and it's your home. And I had a few accidents. On the submarine, you have what we call watertight doors, and they are not just like a standard door where it goes all the way to the floor. It sits up about over a foot or so. So as I'm climbing through these hatches, I would hit my knee. These hatches are solid brass. Brass doesn't give. So now that gets me to where I'm at. After all that banging around and then getting out into the civilian world, retiring, well, I got a little bit more sedimentary, and I believe a little arthritis may have set in. And over a period of time, my knees started feeling worse and worse and worse. That pain that I had, that pain that just sucks your breath away from you, it was so bad. And I had an aversion to scalpels. Let me say that much. And so I talked to my family practitioner, and I asked him, what can I do? And he sent me to Dr. Dominguez. Talking to Dr. Dominguez, he gave me some choices, and one of the choices first, let's try cortisone therapy. That didn't do much for me. So then we discussed other alternatives, and A2M seemed to come to the forefront of my mind. And talked it over with the wife. She says, if this will work for you and you can avoid surgery, why not? So in doing so, I says, okay, we'll give it a shot. I started seeing Dr. Dominguez, I believe, the last of January of this year. We went through the cortisone therapy, and I had enough. So now we get to, I need to do the fact check. And so we did the fact check, and I was a candidate. And of course, me being a curious person, I did my own personal reading too about what exactly is A2M about. And so in reading, so I go, oh, I'm going to use my own body to heal myself? Why should I have an aversion to that? If it can work, it works. Well, it worked. I came in April 1st, so it's been a little over 6 months now. And they put me at ease, explained to me again. I saw the equipment, and I go, wow, that's fun looking. My knee was hurting badly. So we did the blood draw, and we went through the process of using the centrifuge and everything. And once again, I'm off into another room. Now Dr. Dominguez comes in. He just talks to me a little bit and tells me a little bit more, gives me a little bit more information, and it just verified the things that I've read online about A2M, ALPHA2M, ALPHA2ACTIVE, how all the terms I've read, and I'm going, okay, so now let me see if I get this right. And so I asked questions. I says, now, from what I read, we're going to take an active enzyme from that is secreted from my liver, put into my blood, that's put in my bloodstream. The reason why we use a centrifuge is because the molecules of the enzyme are too large to enter the small space in the gaps in my knee. Am I right? Yeah, yes, you can read. Yeah, I can read. So now we do the procedure. And painless. I've had injections before in my life. Big needle. Nothing that I didn't pass out from. I walked out that day. I don't know what my expectations were, but I was thinking to myself, if the pain was only halved, I'll be satisfied. That night I felt better. my needle. My wife says, well, how do you feel? I says, I actually feel better. The next day I got up. I'm not so bad. 48 hours, I was walking with very little pain. 1 week later, no pain. I have sustained that now for over 6 months. Now, don't get me wrong. Age is catching up to me. And I can't say I'm totally painless, but I know the causes of why I do things. I overdo stuff, things like that. It's just like anyone else if you overdo something. Even someone with a totally healthy joint would have these problems. So I attribute it to aches and pains and me learning to live and at my age. The best thing about my recovery, I believe, it was gradual. And being gradual, you didn't seem to notice all the time everything that was going on. If you were for me to describe my pain on a scale of 1 to 10, I was probably about a 9.5 on my pain. 48 hours, 2 days later, I was probably down to about a 2.
Incredible.
And at about 1 week out, I was down to 0.5. There is a dramatic difference that I feel today. So that is most of my story of how I came to deal with my pain, and my resolution to my pain was seeing Dr. Dominguez. It was probably one of the best choices I ever made. It was probably the best investment I have made in myself. In the last 10 years, I would say it is my second best decision I've made in 10 years. Can't leave the wife out. Just day-to-day chores around the house, going out to the garage and bending down to, say for instance, put air in the tire. Things like that, you go, oh my goodness, that hurts. And the recovery time from it, to sit back, relax. And one of the better things about it, I don't smell like being gay anymore. It also prevented me from playing just some leisurely sports, playing a little, shooting a couple hoops around the yard, pleasure riding our bicycles. We have a beautiful community where we live at. Lots of trails, trees, and we just wanted to ride and walk those. I was prevented from walking a great deal because all of a sudden I had to stop and say, hey, my knees hurt. I've come a long way. The bicycling, the common everyday activity, chores, even things like cleaning the bathroom. I guess I have chores to do. Bicycling was pretty much out of the question. And I can say that much. Just that repetitive motion, it was not very good for my knee.
Right.
And I enjoy that. Even the standing alone bicycle, or I have my bicycle, my trail bicycle, and I also have the bike at the house so I can sit back and watch the baseball game now, watch the World Series, and ride my bicycle. We went to Florence last year also, and we spent 7 days in Florence and Milan and parts of Tuscany. Lots of cobblestones. I could not wear sneakers. I had to stay in hard shoes to do my walking. I love going to museums, and Florence has museums to go to. And we went, and of course you cannot do without the food and the wines there. Fabulous. I was not going to let that pain get in the way. Now I think about what if I had went after I had the procedure? How much more we possibly could have done. And so I'm looking forward to going back pain-free. Veronica and I are planning on a trip to Tuscany so we can do a wine tour. go see your family practice doctor and have them refer you to Dr. Dominguez or a doctor who offers a similar treatment. Please explore this. I cannot attest to anyone else who it works for but myself. But in saying so, I say it works. But living the last 6 months without pain, it reminds me of when I was 30 years younger. The recovery time for surgery for a lot of people can be as long as 6 months to 9 months for knee surgery. I'm talking about being pain-free in less than a week without surgery. And I use my own body to heal myself. What else can you ask for?